Hey, my dear friends, you're welcome, dear listeners, and our friends around the world, in Nigeria and around the world. This is Vital Health International, a health conversation to help you eat healthy, live healthy, and feel healthy, and spend less money on doctors, on hospital fees, and on medical bills. It is my desire and our desire as we go on to help you live out your life on earth as God planned for you to live out. That's why this health conversation is coming your way, and I do hope that by the end of this program and in the subsequent weeks, you will learn a lot. Yes. Now, we also talked about diabetes.
Yes, we did.
And we said that diabetes, is it when you have jadi?
It's been a long time I heard that word, jadi. So we defined, or we said diabetes is a problem with sugar metabolism.
Yeah.
And we said that when you check your blood glucose randomly, meaning at any time of the day, if it's greater than 200 milligrams per DL, or when you check when you've been fasting and it's greater than 126 milligrams per DL, or when you check the A1C, the glycosylated hemoglobin. And we talked about this being the glucose covering or layering on the red blood cells, and this gives you an estimate of your 3-month worth of sugar intake. So if you check that and it's greater than 6.4, that's an instant diagnosis of diabetes.
Okay, yeah. And when that happens, don't play around. Don't play around, because we call these diseases silent killers. There are other things that are silent killers. But this one particularly, they are prominent in our communities. A lot of people have it because of the kind of lifestyle modification that we have gone through by the introduction of westernization and urbanization. So a lot more people are beginning to have high blood pressure, and a lot more people are beginning to have diabetes. And these things are not well managed. And so what happens? They drop dead playing soccer.
The slumping syndrome.
The slumping syndrome. They die in their sleep. Sometimes they are playing a game, or they are in the chamber of the politics or political parties, and they slump there. And what do they say? Their enemies have killed them. So when that happens, I know it's a condition that affects a man's ego. But what do you suggest? Does he need to see a doctor, or what? Or just hide it?
Yes. Not just because of erectile dysfunction alone, because it's a harbinger. If it's from something like a blood vessel disease.
That's right.
Yes, we talked about this yesterday, that the blood vessel being affected is not just the one that goes to the penis. It's the same blood vessels that get to the heart, that gets to the brain.
Okay.
So if there's erectile dysfunction, what's to say that a heart attack won't happen?
Yeah.
A stroke won't happen. So if people have erectile dysfunction, don't believe that, oh, it's only older people. Don't believe that, oh, there are so many myths associated with it that it doesn't need to be treated. Yes, it needs to be treated, and it needs to be treated appropriately.
Yeah.
One has to find out why before treating it. It's not just swallowing the blue pill.
Okay.
You have to find out why.
So that's very important. When you get the treatment, so you find out what's causing the condition, and then you want to see a doctor. You don't want to hide it. You don't want to pretend that it does not exist.
Yes.
You know, that does not mean that you go around telling everybody, or you go to a prayer meeting and you are not sitting in the prayer meeting.
If you are comfortable with it, Dr. Taken, if you think that, oh, I need to announce it and this is the instruction I got.
You know, but you need to see a doctor and then follow the doctor's prescription. If you're given medication, you need to take it, do the exercises that you need to take, you need to do, get medications. Some of these disease conditions that will affect either your testosterone level, affect your blood pressure, affect your sugar level. You want to comply and just ensure that you get properly treated so that you can perform well at home and make your family happy, isn't it?
Yes, we didn't touch on the psychogenic etiologies of erectile dysfunction, meaning issues with the mind that can cause erectile dysfunction.
Yep.
So in those cases, at times it could be relationship issues. At times it could be a new partner, anxiety issues.
Yes.
And at times some medications too
cause
it, especially medications that are used in the treatment of psychogenic issues too.
Yeah.
So if that is happening, the first thing you do is talk to your doctor so that they can identify the why.
Yeah, I make changes to those
Yes.
medication if it's necessary.
Yes, at times they might even recommend you see a therapist. You might have to see a therapist with your spouse.
Yes.
Sex therapy, sex counseling. Yes, that's the right word.
Yeah, and sometimes depression too. People who are depressed, can have that problem.
Yes.
People are depressed because that's also another major issue that affects people.
Yes,
Yeah.
people don't believe in. When I was a medical student, there was nothing called depression.
No, we didn't know there was something called
There was something called, I remember going on postings to Arrow, and we talked about, and we saw, and I cannot remember. Maybe I wasn't in class, but depression is real, and it's been so stigmatized, especially in the Black community, that you are not strong enough. It's a thing of the mind. That why are you? Boy, it is real, and nowadays we are seeing it occurring more and more. People getting depressed and committing suicides.
Yeah.
This is happening. It's not something to turn our backs to and pretend it's not there. So, how do you know maybe someone you know is depressed?
Yeah.
There are some basic things you would want to look for.
Yeah.
Is this person who usually would hang out with their friends saying, no, I do not want to go out?
Now, let me pause you there for a moment. Before you begin to talk about some of the symptoms of people who are depressed, let's even just dig deep a little bit and talk about the demographics. Some of the people who actually have depression and have expressed depression. Because the other day, if you follow the news, I think this happened, was it last year or 2 years ago? A medical doctor jumped over the bridge in Lagos, somewhere between, if I remember, somewhere between the barracks in Victoria Island and what used to be Erectile post office. I've forgotten what that bridge is called. Jumped over the bridge into the lagoon and just killed himself. So it was later some of the friends were saying that, okay, I think he was sounding a bit depressed. And if you follow the news too, last year, here in Maryland, a medical doctor, I think it was a cardiologist or something, he just shot himself in the presence of his family. And we later discovered that he was having issues with his wife, and he didn't want, he thought he would lose his children. So out of that depressed state, he killed himself. So this is something, like you rightly mentioned, it is commoner among people than we think. And that's why parents need to watch out for their children. Yeah?
Yes. And you say medical doctors. I've had 2 acquaintances, maybe friends, who are doctors, kill themselves as well.
Okay.
In the space of 12 months.
Wow.
So it is real.
Yeah.
It is real.
Yes.
And you should be careful with your children and not ignore some of the signs that they might show.
Yeah, which you're going to be talking about some of those signs shortly.
Yes, your teenagers, your little children, things like that happen in them. Don't ignore those signs.
Yeah. Because you said something that when you were in med school, you didn't even know that there was depression. It was not that it wasn't there, but again, well, perhaps it wasn't there as much as it is today because there's been so much evolution in the society. Things that we have today, we didn't have them then. Diagnostic features that we have today, we didn't have them then. But mental health has become such a thing today that we're now finding out that a lot more people are having mental issues. Christian leaders are having mental issues. Satanic leaders are having mental issues. Celebrities are having mental issues. And they are depressed. They take the alcohol, they get the booze, they do some of the things they do in order to keep them going. But that does not sustain them because depression and mental issues is a reality. So now let's talk about what are some of the things that you may see in an individual that will give you the hint that something is wrong here.
Yeah. So I started with saying maybe something like someone who would usually hang out with people, or someone who would usually maybe read a book or watch a movie. Things they used to enjoy, they no longer want to participate.
That's right.
Someone who is hanging out in bed all the time, and at times lethargic, and at times it might be someone who even can't keep still. It's too restless.
So just restless.
Yes.
So they're moving around because they're depressed and they just want to.
They're restless. They are trying to maybe cope or accommodate what's going on with them.
Yeah.
And some of them might have difficulty concentrating.
Yes.
You are talking to people and you're having to repeat it 10 times,
Okay.
what you're saying.
Okay.
And some might be eaten.
Okay.
They don't eat or they eat too much.
Okay.
even within, as a feeling of guilt.
Yes.
Maybe I'm not enough, I've not done enough. Is my life enough?
The feelings of worthlessness.
Yeah, worthlessness. These are things to watch out for when people start talking about maybe I'm better off being dead. That of what purpose am I here or not for?
Yes.
That I'm not contributing.
Yeah.
But what I found out in what you said, there was something you said, that evolution. I am of the opinion that the society is changing. There isn't a lot of support like it used to be.
Okay.
In the past, everybody was into everybody's business. But now, there's the family unit is breaking. Relationships are not as they used to be.
They are not as
at
strong
times,
as they used to be, yeah.
Yes, because before you would know, Mr. A, you didn't come to hang out with us. What's going on with you?
Yeah.
But now, oh, hi, how are you? Oh, you don't want to hang out? Oh, all right. But
They don't even call. They send a text.
yes. But before, you had to knock on the person's
Person's
door.
door.
And when you did, you saw the disarray in their house.
That's
you saw
right.
how they were doing.
Yeah.
Well, now, the support system is
It's not there.
breaking.
Yeah.
It's breaking.
Yeah.
So when you don't have a friend who notices you are not smiling,
That's it.
how do you know someone will miss you? Yeah.
So you begin to, it aggravates that whole feeling of worthlessness, and then people get isolated.
Yes.
They want to stay alone. So one of the things that you know, or one of the highlights you see in people who have always been in community, in the mix of their friends, and then they're just getting isolated. They're locking themselves alone in the room. Because I remember many years ago, there was a call I got, and they told me of a particular young lady who always locked herself in the room, and her family got bothered. And then I spoke with another one who, guess what she told me? She said she had taken a particular exam several times and she didn't pass the exams. And so because she didn't pass the exam, she thought that she would never pass. You know, she was worthless. She's a failure in life. All her friends appeared to have gone ahead of her. And so she was very depressed. And not only was she depressed, she was thinking of ending it all.
Oh, that's so sad.
You know.
That's so sad that we're letting societal standards be
the measure for
our success.
Yes.
No,
you know,
so
she was thinking
that's
of
so
ending her
sad.
life. And go ahead, sorry.
Yeah, no, I was just talking and thinking about depression. Depression occurs in different, and it could occur in a child, and it could occur in an older person.
Yes.
I lost someone recently. I think
Okay.
I shared that with you. An 80-year-old man.
Yeah, you told me that story.
Yeah, he killed himself. You would think, you're 80. Why are you killing yourself? How many more years? Well, yes, there's something called, is it the gray syndrome, or the older people are now the ones that are suicidal, and you
Why?
can't.
Is it because they think that they did not succeed in life, or did
No,
not
I
accomplish
think it's
their
because
goals
of
in life?
loneliness too.
Okay, that
a lot of
loneliness.
people, like I said, the family unit before. In the past, grandmothers will live in the house with you.
Yes, right.
Yes, but that's not happening
Now you
anymore.
don't even
Grandmothers
want
are
them to
living in,
come.
yeah, they're
Yeah.
living in their own houses by themselves. They have to fend for themselves. So when things like that are happening, they don't have a support unit. They are lonely. Yeah, so that could lead to depression and suicides.
Yeah, and that's why our, many times those of us in Africa, we want to be westernized. We think that the Western culture is the best thing that ever happened before since sliced bread. But listen, our own culture is strong and powerful and
Yes,
supportive.
yes.
You know, the fact that, yes, I do know that there were family members who showed up in your house without any notice. They just show up and they come and stay there for months and all that. But today, they have to text you, they have to call you, they have to get a confirmation that they should come, they have to get your approval that they should come. But listen, that family unit, that family structure, that fabric is part of what helped our parents, our foreparents, and members of our society. So depression is a reality. So now if I identify that a member of my church, a member of my community, a member of my family is depressed, what do I do? Scold them, lay hands on them, cast out the demon of depression, or what?
First, make yourself available.
Okay.
But it depends on what the person wants.
Okay.
If the person doesn't need you to be available, just let them know I am here. I'm
Okay.
support, but
Okay.
I'm not in your business.
Okay.
That goes a long way to helping them know and think that there's somebody out there.
Okay.
Suggest therapy. It's
Okay.
not a bad thing.
Yeah.
And then there are Christian therapies these days too.
Yes,
So
yes.
Suggest therapy.
Yeah.
Talk to them about seeing their doctors. There are doctors online too. We have doctors too
Okay.
who can talk.
And in Tell MD,
Yes.
this one of the services that you offer.
Yes, yes,
Yeah.
yes. Even to children.
Yes.
Yes. So talk to a doctor. If it needs to be medicated, medicate. Don't say, oh, because you are sad, you are using medications. It's a situation of sadness that one is not coping with. So that's the key word, not coping with it. You don't want it to get to a position or a point where they get suicidal.
Yeah.
Yes, so it's better when it's identified in time, diagnosed in time, and treated in time.
That's very powerful. I mean, diagnosed in time, identified in time, and treated in time, because that's critical. Because when depressions are not treated, they escalate, they snowball into a lot of other conditions. And like she said, like you rightly said, the suicide. There was a time in Nigeria when a lot of young people were drinking sniper.
Oh, I heard that from my mom. I didn't know what it was.
I
She
didn't
was
know
like, they will
either.
just do sniper and they'll be gone.
Oh, yeah, they'll be gone. Yeah, they did. I mean, at least some of them called me. You know, at the time I was running the Vital Health radio program, they called me. They wanted to. There was one guy who said that his father did not have enough money to send him to school, to university. And it's funny, he lived near the redemption camp. You know, his father didn't have enough money, so he was actually thinking of doing the sniper thing. And you know, this copycat syndrome, where their friends were using it and they were dying, so they thought that, okay, one way to terminate the pain, one way to just make sure that I end it all, terminate the shame and everything, take sniper and I'm gone.
And it's terrible. Some people take sniper and don't die.
And the
they
side
live
effect,
a very miserable
oh God
life.
have mercy, the life they live after that is terrible.
Very miserable life.
So it's critical. So when you discover somebody has a depression, I want you to try to be present. Do not ignore those symptoms. Don't scold, particularly if it's a child or even if it's a friend. Don't scold them and tell them to get their life together. You know, get up and put yourself together. If something is going on in them, and it's important. Something you said is that they need to see a doctor, because sometimes this depression is due to some chemical imbalances in their system.
Yes. It could be inherited. People do not know that.
Yeah.
It could be maybe a parent has depression.
Yeah.
Maybe there's a history of addiction in the family. Those kind of things are familial tendencies that one has to watch. Has there been an attempt of suicide in the family? So this could be inherited. And we'll say, so the medications that one uses, it helps in balancing those chemicals in the brain. Yes, to help treat depression. So it's not something to be ignored. It's not something to be ignored at all.
Okay. Wow. Now, if you're just tuning in, this is a conversation. It's a health conversation, Vital Health International. And I am having a conversation with Dr. Toyin Okpelami, who is the CEO of TELMED. TELMED is an agency that caters for patients in Nigeria. It gives you an opportunity to call in virtually. They can talk to you. You can call in either WhatsApp. You can call in using your phone any time of the day, 24/7. You can call in and the doctors can consult with you virtually on Zoom call, on WhatsApp call, on the telephone. You can use your tablet, you can use your computer, you can use it and call them. They will attend to you. It gives you the benefit of accessibility. It gives you the benefit of affordability. They are not expensive. And it gives you the benefit of empathy, specialized, tailored treatment to you in the privacy of your choosing. So, my friend, this is a platform I would like you to take advantage of and tell your friends about it. Call in and get that consultation. There's a phone number, there are contact numbers you can reach, 0707 660 7330. 0707 660 7330. And the website is telmdng.com. telmdng.com. And in case all of this is lost in translation, if you contact me on my IG handle at Dr. Joe Tarkon, Tarkon, I will get the message across to them. As important, you can check them on the website or on Facebook, TELMD. Now, we have been having a very exciting conversation about different topics, and depression is something that is ravaging the community right now. There's another thing that is also of great concern, Dr. Toyin, and I'm sure you have seen it in your practice and you hear it. A lot of young Nigerians are having cancers. A lot of young Nigerians are dying of cancers. And when some of them have these cancers, they hide it. Some of them have these cancers, and by the time a diagnosis is made, they think it's well advanced because early diagnosis was not made, and so treatment was not, appropriate treatment was not given. And for many of them, when they have cancers, they blame it on their mother-in-law. They blame it on a co-laborer in the office. They say there was something they put in my food that I ate, or they come up with all kinds of conspiracy theories. Now, say it to me in a layman's way. What is cancer?
Is there a layman's way of explaining that? But it's when cells are supposed to grow in a particular way,
yes.
like the way children are born and they look like their parents.
Yes.
So when a cell is growing, it's supposed to look like the parent.
Yes.
But when it now doesn't look like the parent,
yes.
it starts to behave like a child that is not part of the family.
Yeah.
It starts to behave abnormally.
Yes.
And it starts to function in its own way and dancing to its own tune.
Yes.
Usually that's what we call cancers.
Yes. So, so these normal cells that are supposed to be in somebody's body and grow normally, because every part of a person's body has cells,
yes.
right? Now, cells make up the whole body.
Tissues, and then the tissues make up the organs, and the organs make up the systems. Yes.
So everybody has got cells. So these cells in your body, for instance, we'll talk about some of the very common ones that have been affecting our people. So a breast, for instance, has a cell, and then this cell that is supposed to grow normally and die, after about 90 days, refuses to die, continues to grow abnormally, and it continues to grow abnormally and begins to take in all the food, right, that is supposed to go to other parts of the body. And this cell now becomes an abnormal cell. It's like a mad person in the body.
And then it produces children that look like it. And some of the children too get mad and produce worse children.
Children, yeah.
Yes. So that's the children's children, they begin to, what's the word? The abnormality,
yes.
how abnormal they are, gets worse as they grow. And at times it becomes a very aggressive cancer.
Yes.
So early diagnosis is always the key.
Very important.
Yes. This is why we continue to talk about preventative,
yes.
proactive, and
yes.
not reactive.
Yes.
So see your doctor. It's not only when you are dying or when something is wrong. Oh, I'm just 20. 20-year-olds should see their doctor at least once a year.
Yeah.
I am 60, and in my life I have never used the medication. Still see your doctor. Let your doctor say, you are fine.
Yes.
Just that once a year visit to screen for health issues, to screen for cancers is very important.
Yes. So, see, I don't know if there's any way of overstating this, the importance of seeing your doctor regularly. And that's what TellMD actually offers you. You don't want to get out of your house. Let's say you run a busy schedule. Today you're in the air, tomorrow you're in the boat. You can call them anywhere you are, anywhere. Once you have a cell phone, you have a computer, you have a laptop, you can call them and schedule an appointment through the platform Zoom, right? Team Meet, right? And all the other platforms that I don't even know about, they can reach you, correct?
So we are on social media. You can reach us through that. But when we have a discussion, especially when it's a video discussion,
yes.
we want to keep your privacy.
Yes.
So we have an electronic medical record that we use that is NDPR compliant,
okay.
meaning that your information cannot be sourced from somewhere else.
Okay.
I know this is not an American system, but I still use EPA too, meaning that your information cannot be sourced from outside.
Okay.
So you see us on that medium through our electronic medical record system. It has a telemedicine platform, and everything is private. It's just you and the doctor you're talking to.
Okay.
Once there's nobody around you,
yes.
the doctor has nobody around them, but
yes.
once there's nobody around you,
your information is private.
It's private.
So that's something you should not worry about. I don't want you to think that anybody is tapping into your call, as long as you keep it private. Because on your own side, you have to keep it private, not something that you are in a conference and then you are talking and everybody else is listening to you, or you are in an insecure room and everybody else is listening to you. So as long as there's privacy. So that's why it's important for you to get screened, because a lot of the cancers, early diagnosis is critical.
Yes.
And once the diagnosis is made on time, treatment can be initiated very quickly.